So I came across an article called Facelift Forward in Vogue magazine, and I had to give my cosmetic dermatologic perspective on it. It may sound offensive, but I think it's important we have the less invasive perspective. And what the article is about is a trend of, in this case, women foregoing non-invasive treatments and just waiting or going straight to a facelift procedure. And this is in the backdrop of what I call filler fear, injectable fear, where people are having an appropriate, more cautious or fearful approach to some of the more overutilized injectable treatments that are out there. Now that's a whole nother subject, but the fact of the matter is surgery and less invasive treatments like injectables aren't necessarily interchangeable one or the other. In fact, a lot of people who even go for surgery still need injectables. What neuromodulators like Botox does, surgery can't do. What lasers do for sun damage, fine lines, acne scars, things like that, surgery cannot do. And I would say one of the most common situations that I have when people come after facelift is that they complain around the mouth area because they didn't get rid of all the lines around the marionette folds or the nasolabial folds. You cannot pull too tight. People go like this and they think the facelift is going to get rid of 100% of everything around the mouth. But almost universally, it does not. And it's almost like when you paint 3 walls of a room, all of a sudden you're noticing that one wall that's unpainted the most. So it's very common a few months after facelift surgery that a patient will come back. They still need their neuromodulator. They need some, small amount of filler, much less than they may have needed prior, but they still need a little filler around the mouth or in other areas. In fact, and this is a lesser spoken about issue, but a lot of patients after facelift surgery develop what's called lipoatrophy pre-auricularly, which means they actually lose natural volume of the face from the inflammation of the facelift. Now, this could happen early, or this could happen actually years later. So it's almost universal that on patients who have had a facelift in the near or distant past, I need to revolumize them over time here. They'll complain about redraping, but sometimes that redraping of tissue comes from that dramatic loss of volume laterally, or what we call pre-auricularly in front of the ear. By using biostimulatory fillers like Radius and Sculpture, we could revolumize that area and create a little bit of a resuspension of tissue, sometimes preventing a patient from needing another surgical procedure years later. So the point of this whole thing, to make it shorter and sweeter, is that it's not surgery or non-invasive. And often the best treatment is going to be from a combination of everything. Now, there's certainly a limit where a lot of non-invasive treatments can do before it becomes a perversion. Too much injectables, too much laser, too much non-invasive skin tightening. It's really not the option for everybody. It's the important job of the provider to know that limit of non-invasive for a patient so they could refer them at the appropriate time for surgical intervention, because having surgery too early is not necessarily the best thing. So stay tuned for more information about fillers and injectable fear.